Hi friends, on behalf of Motherhood India, I welcome you all for this FB Live program on gynecologist and menopause specialist working at Motherhood Hospital HRBR Layout, Bangalore. We are all under the clutches of this COVID-19 pandemic, more so in the second wave, more so for India. And this is pretty much common question that we as a consultants of OBGYN have been faced that doctor, shall I take COVID-19 vaccination? We know the burden that it has caused. And then during this FP Live program, I'll be just uh, to be able to answer all your queries that all pregnant and lactating women are facing. In fact, two important measures to reduce this burden of COVID-19 or have control of this COVID-19 pandemic are follow the first ever rollout on a huge scale on COVID-19 vaccination was by US. That was in December 14, 2020. And in India, the first massive scale vaccination program against COVID-19 is started on January 16, 2020, and which is going on in a phase-wise manner. So the important 5 questions regarding COVID-19 vaccination for pregnant and lactating women. Should pregnant and lactating women take COVID-19 vaccination? If so, when and how? How safe are these COVID-19 vaccines for pregnant and lactating women, and what is our present experience so far regarding this vaccination? What are the commonest adverse reactions with this COVID-19 vaccinations for pregnant and lactating women? And a fourth question is like, what are the recommendations by various scientific bodies, national as well as international recommendations regarding COVID-19 vaccination in pregnancy and lactating women? And the most common clinical scenario, the commonest doubts that our patients are having. So coming to the first question, should pregnant and lactating women take COVID-19 vaccination? If you want an answer in one word, yes. Whenever we think of any vaccination for that matter, we'll always try to analyze it in terms of benefits and risks associated with the vaccine. In fact, it was nice during the first wave where we as obstetrician and gynecologists were very happy that the risk of COVID-19 infection for pregnant and lactating women was very less, and even those becoming positive. And then even across the globe, it's been seen that once pregnant women, more so in the third trimester of pregnancy, once get COVID-19 infection, there are more chances of severity of the infection, more chance of admission to ICU. And then in the just last 1 month April data in Karnataka itself shows that about more than 100 maternal deaths have already been documented. So it has almost become a public health problem, not just for general population, but for even pregnant and lactating women. Though we all know that pregnancy as such is an immunocompromised state. That means to say, ability of an individual to fight against any disease is relatively low in pregnancy. But then luckily during our first wave, pregnant women were very well protected against COVID-19 disease, unlike in second wave. So thus, it's a time that we as obstetrician should come up and then educate our pregnant and lactating women regarding the importance of this COVID-19 vaccine during the phase that they are going through. Coming to the risk factors for that matter, is it, the very next question I know will be asking, like, is it really safe to take this vaccine during the pandemic? Yeah, all the studies that have started regarding the vaccination, whether it was phase 1 or phase 2 studies, it's true that none of the pregnant and lactating women were enrolled into the study group. It is not just in India, in fact, it is across the globe. But looking at the magnitude of the problem that presently we are facing, when you have to think of safety concerns regarding the vaccine, few things are clear. All the vaccines that are presently available across the globe are not live vaccines. That means to say, they are not going to cause COVID-19 infection in pregnant and lactating women when they have taken. So these are basically a dead virus or a particle of the virus which have been used in the manufacturing of these vaccines. And second thing is, all the components that are used in various vaccine production have already been proven to be safe during pregnancy. And presently we have a data regarding other similar kind of vaccines which are using for many number of years during pregnant and lactating women. Like for example, even a flu vaccine or a rabies vaccine and pertussis vaccine. Such similar vaccines which have already been proven to be very safe and have been routinely being used during pregnant and lactating women. Coming to the data regarding vaccine, COVID-19 vaccine in pregnancy and lactation. Yes, as of now in India, we are not yet started for a pregnant woman, but we already have a data of our Western population. Once the COVID-19 vaccination program was rolled out, it was basically the high-risk group of pregnant and lactating women which were allowed to take vaccine, which are in fact recommended to take vaccine, basically healthcare personnel who have a very huge risk of exposure to COVID-19. This again in India as well as even the Western population. But what data we have presently regarding the safety of this particular vaccine is, in US, it is more than 90,000 of the pregnant women have already taken a vaccine, and the vaccine in US is basically mRNA vaccine. In fact, that is the vaccine which has never been tried and tested earlier before this COVID-19 era. So even in those 90,000 pregnant women, and few of them have already delivered, and safety regarding the vaccine has been proven beyond doubt. So when it comes to is it really safe to go ahead taking this vaccine? And the other thing what you see is the risk associated with COVID-19 disease per se is much more than the benefits that you are going to get by taking vaccination. And even there are studies where they have just studied the immunogenicity or the response or the antibody response that you get after getting the COVID-19 infection in a pregnant woman versus after taking the COVID-19 vaccine. And there's a gross difference, and there is exponentially increased antibody response to the COVID-19 vaccination in contrast to the natural infection of the COVID-19. Thus, safety wise, it can as well say that yes, you can just go ahead and take this vaccination. So coming to some of the commonest adverse reactions related to the vaccine. It goes without saying any drugs cannot come without any mild side effects. So what we'll be looking at is what are the major benefits that we are going to get out of this. So when it comes to COVID-19 vaccine, it remains the same. There are very minor side effects, and the most common noticed adverse reactions with COVID-19 vaccines are basically a injection site pain, redness, or sometimes even swelling, and the other common fever, which can happen in the initial 1 to 2 days and the maximum about 3 to 4 days, and then generalized flu-like symptoms, headache, rarely rashes with few vaccines. Bare minimum, in which case a person can present with basically a blood clots in the brain. So even those who are taking, which can happen even like within 2 weeks of exposure to a vaccine, and it is not particularly related to any vaccine per se. It is now known that it may be because of an idiosyncratic reaction when individual first time get exposed to the vaccine. Coming to the vaccination programs in India, presently we have 3 vaccines that have been approved by Government of India: Covishield, Covaxin, as well as a third vaccine which is already been approved, and then shortly it will be started from maybe first week of June, that is Sputnik V. Comparing these vaccination, in fact we don't have head-to-head comparison of these vaccination, whether it comes in terms of efficacy, whether it in terms of adverse reaction with the vaccination. So any vaccine that is available when you go to take vaccine can be permitted. You can take, you need not have to really delay your vaccination thinking in terms of like this vaccine, Covaxin is better than Covishield, or Sputnik V is still better than Covaxin or Covishield, these kind of concerns. But I know your next question will be, since now the availability of both the vaccines, Covishield and Covaxin, are there at few centers, your next concern will be if you have an option of both, which should be preferred? Yes, if you have an option of both, Covaxin may be preferred over Covishield because of some commonest things. One, the rarest side effects that are being studied, like the blood clot problems, are again very well notified in UK as well as US. In UK, it was basically AstraZeneca vaccine, that is a Covishield, but again, these are not directly related to vaccine per se. And that's why if you have an option of both, probably Covaxin may be preferred over Covishield. The second the common logical thing that if you can think of, these vaccines, when it comes to Covaxin, it has to be taken as 2 doses, 4 to 6 weeks apart, intramuscular injection in the deltoid or in the arm region. And when it comes to Covishield, it has to be 2 doses, 3 months apart. So if you think as a logical perspective, when it comes to vaccination during pregnancy, we have other vaccines also that have to be routinely given during pregnancy, whether it is first dose of tetanus toxoid followed by a Tdap, tetanus, diphtheria, and then pertussis vaccine, and the flu vaccine, and the third now being the COVID-19 vaccine. Logically speaking, if I had to give any vaccination with around this era, there has to be at least a gap of about 2 weeks between COVID-19 vaccine and other vaccines. So if you have to give a gap for a Covishield, the gap of about 3 months, and then we barely have a time for giving the vaccination, mainly Tdap, TT, as well as a flu vaccine. So that way also, Covaxin may be preferred over, just sorry, yeah. Sorry for little technical hazards. Yeah. So thinking in those logical terms also, if you have an option of Covaxin and Covishield together, you can just go ahead with the Covaxin vaccination for pregnant and lactating women. When should pregnant women take the vaccines? Again, it can be taken anytime, but it is always preferred to avoid the initial 12 weeks of pregnancy or the first 3 months of pregnancy, and then after that, you can just go ahead taking the vaccine. And other thing, when you think regarding a lactating woman, yes, it can be taken by a lactating woman at any point of time soon after delivery also. Just ensure, and pregnant women should not stop breastfeeding the baby. There are few other advantages of giving vaccination to pregnant as well as lactating women, again, which have been already proven by the studies that have been done amongst the women who have already taken. These are basically, one, the antibodies that are produced against the COVID vaccination for the COVID disease per se are found even in the cord blood. That indicates that they can passively immunize or passively give some protection to the unborn baby. And even the breast milk is going to secrete the IgA antibodies, which again help the baby to get some protection against this COVID-19 infection. So coming to the other common concerns, what exactly is the recommendation across the globe? When it comes to international bodies, in fact, whether it is UK or US, in UK, right from April 16th, they have given a permission, and then the recommendation is basically like all pregnant and lactating women should be offered COVID-19 vaccine. And there are very clear-cut guidelines saying that we as an obstetrician will be giving the information regarding the safety, the necessity of this vaccination, but we need not have to really go ahead and taking a written consent saying that all these things are being told and then this is injection is being taken after having, I mean, we need not even really have to bother about taking consent. It has to be as like any other general population. And even vaccination site for that matter can be just like where we have a vaccination drive centers. A pregnant and a lactating woman can just go and take vaccination. And managing even the adverse reactions should be like any other general population, and there is no specific thing for pregnant and lactating women. And regarding the recommendation in India, recently, that's on 21st of May, we have got recommendation or approval from the government of India regarding vaccinating lactating women. So it's all go ahead for lactating women. And in fact, just yesterday, Karnataka government has sent a circular saying that lactating mothers should be, and then they should be given a priority when vaccinating against COVID-19. Regarding pregnant women, still we have not yet got a green signal from government of India, but then it has been put forward by FOXY or the National Body of OBGYN Society to the Government of India to make it available to all pregnant women. And it may be just, and we should really, as the OGCians of India, we should really thank our President Alpesh Gandhi sir and whole his team, which are relentlessly working on to make it available to all our pregnant women. And then we are just hoping to get a green signal from Government of India also shortly, maybe a matter of a week. So once it is available, so though as clinicians, we recommend our pregnant women to go ahead taking a vaccination, presently till we get approval from Government of India, where we have a column, if you are pregnant at present, you may not be allowed to take vaccination, but it is just a matter of week time where we are hoping that we'll get a green signal from Government of India as well. So coming to few other common concerns that we have been facing on day-to-day basis. Is there any relationship of the menstrual cycle with COVID vaccination? Absolutely no. You can take COVID vaccination at any day of your menstrual cycle, which is not going to interfere with normal menstrual cycle pattern or the amount of bleeding or any other symptoms. Yes, those people who tend to have little premenstrual symptoms, they may have a coincidental vaccine associated adverse reactions, which may feel that it may be little more in those patients. And apart from that, does COVID-19 vaccination interfere with the fertility? No. Those who are planning to pregnancy can also go ahead taking a vaccination. They need not have to postpone their plan for conception because of COVID-19 vaccination. And regarding any other concerns when it comes to vaccination, it is regarding the safety in pregnant and lactating women. As I've already told, we are in a position to say that it is go green and then you can go and take the vaccine. So just to summarize whatever I told so far, should pregnant and lactating women take COVID-19 vaccination? Preferably yes. And again, it is not a compulsion. As a clinician, we can only give information regarding its safety as well as the huge benefits associated with the COVID-19 vaccination. But then again, ultimately, it is a choice of an individual, in which case, even if a person doesn't really want to take vaccination, their decisions all will also be equally justified. And regarding safety, yes, it is safe, proven beyond doubt regarding the safety about the vaccination. Adverse reactions associated with COVID-19 vaccination are same like any other general population and not different from general population, and even the management of these things are similar. So with this, I'd like to end my FB live. You all have an option of asking any other questions regarding the vaccine related things. Yeah, I just got a question. Can you please elaborate whether women trying for pregnancy or infertility patients for IVF, when to take vaccine? What if they conceive after first dose? When to take second dose? Yeah, as I told you, it's there are good number of studies where they have really studied whether is it really toxic For the fertility part, no. They need not have to really think in terms of whether I need to be planning my pregnancy little later, or even if they're planning for IVF. Also, they can continue with their plan taking COVID-19 vaccination. And even if they become positive, they can take their regular vaccination. Like if they have taken a Covishield, again it is 3 months apart, and if they have taken a Covaxin, they can just go ahead, because this is again, we know vaccines are in place in less than 5 months, and for pregnant and lactating women it's hardly been 3 months. It's very premature to conclude on those things. But then looking at our huge data that we have, and even good number of patients who have taken vaccination in US have conceived within their 30 days. And then they have observed whether there's a risk of abortion or whether teratogenicity. It is very clearly shown that there is no associated teratogenicity so far. And even the risk of abortion was same like any other non-pregnant woman. As of now, we have a clinical trial that is going on in US, in which it basically started in Feb 16th, and is supposed to be going on till about August, and we'll be expecting the result later August, where about 4,000 pregnant women, in which they have a placebo controlled randomized study, has been planned. But knowing the present data, we need not have to alter the plan for couple who are planning for IVF pregnancy or those who are planning for pregnancy because of COVID-19 vaccination. The schedule also remains the same, and their plans for pregnancy can also just go ahead simultaneously. So any of you have questions regarding the COVID-19 vaccination during pregnancy and lactation, they can just keep posting on this page. As and when the questions arises, I'll be just answering you when I see the questions. Thank you so much, all of you.